Hi everyone. Today in this video, we'll take you through a step-by-step upper anterior crown preparation. Use depth guides or burrs to ensure uniform reduction. For all ceramic crowns, aim for 1.5 to 2.0 mm incisal reduction. For PFM, slightly less if indicated. Start incisal first to establish length and incisal edge. Reduce facial surface conservatively, typically 1.0 to 1.5 mm for all ceramic, with slightly more for heavy porcelain. Maintain axial contours and avoid sharp edges. Keep the lingual reduction adequate for material thickness, about 1.0 to 1.5 mm. Finish line for anterior crowns, a chamfer or shoulder depending on material. Create a smooth, continuous finish line with rounded internal angles to reduce stress in ceramic. If margin is subgingival, be atraumatic to the sulcus. Open interproximal contacts slightly to allow path of insertion, but preserve contacts for later re-establishment. Check neighboring teeth and maintain proper emergence profile. Refine and smooth all line angles and finish lines with fine diamonds finishing burrs. Remove any unsupported enamel and create a clean margin for the impression. If there's bleeding, use a hemostatic agent. Rinse and dry thoroughly before impression. Moisture ruins detail. Select the correct tray. Take the impression, inspect the impression carefully. Margins must be clear, no voids, and soft tissue retracted. If anything's missing, retake it. A poor impression is equal to delayed lab work. Choose an appropriate maxillary impression tray that comfortably covers all anterior teeth and allows sufficient space for alginate. Alginate mixing. Measure powder and water as per manufacturer's instructions. Use room temperature water for optimal setting time. Mix vigorously in a rubber ball using a spatula until you achieve a smooth, creamy consistency, no air bubbles. Loading the tray. Load the mixed alginate evenly into the tray using a spatula. Avoid trapping air pockets, especially in the anterior labial region. Taking the impression, retract the patient's upper lip gently. Seat the tray from posterior to anterior with light. Even pressure. Hold in position until the material sets, about 1 to 2 minutes. Ask the patient to relax and breathe through their nose. Removal of impression. Break the seal gently and remove the impression with a quick, firm motion. Rinse, disinfect, and check for detailed reproduction, margins, gingival areas, and palatal coverage. Post-procedural care. Rinse the patient's mouth. Pour the impression immediately with dental stone to avoid dimensional changes. Direct hit key tips. Always mix alginate smoothly to avoid bubbles. Seat tray correctly to capture the labial and palatal anatomy. Disinfect impressions before sending to the lab.